You've done a lot of work in literature review and all that. So I would suggest go straight to your objectives. Tell us what your objectives were, what were your research questions, okay? Briefly, your methodology. If you want to say something on literature, just say excuse one slide. We are more interested in your outputs, your findings, your outcomes, and recommendations. That's what, so that we see, is it really that you're contributing? I'm sure you've seen also in journals are doing that. I've seen journals where they simply say, what additional knowledge are you bringing?
See, I'm not here.
That's what they want. So let's stick to that. I'll give you some changes. The first one, you can come and you know who is starting. Oh, the other one. Oh, but your slides didn't see.
They're here.
Okay. Okay, let me get the latest so that I can use it.
I'm just checking whether you I got lost in your
Is it? What do you have here? Can I copy the money?
That's it.
Oh. Thank you. Should I paste it?
Yours? There's no drawer. There's no drawer. They told me to come to room 2. Assess.
Waiting for the presentation to go on. Our chair is not yet here. I'm presenting the first and second person.
Can I send to you?
Do you have a memory stick?
No, I don't.
There's no email address on these things, so. Are you sure you're not in this room?
No, they said room 2.
Yeah, because I wouldn't know which one is room 2 because the names are mixed up.
Do we have this presentation?
Which one is coming up first?
Yeah. Investigation of what strategies? What is this? Can you read me? I left my script. This one. This one.
Spell it short, Jesus.
Investigation of untreated sewage.
Yes.
It's big.
Yeah. Put it that one.
Is it there?
But it's not this one. This is not this section.
No, it's fine. I'm the one who is sharing.
Yeah. But what I'm saying is, Martin, this is not the right folder.
That's the folder they left. That's the folder they left here. So.
Oh, so the presentations are not here.
This is energy and transition.
Your slide is not there. Your slides are not there.
But isn't our session at the third line?
Okay, let me ask the IT
Oh.
guy to help me.
What is the name of this session?
Do you have all the slides?
Okay. Yeah, the slides are here.
Oh, okay. So, please proceed.
Okay, so it's the fourth one and then the third one. The fourth one on the list. Yeah.
Fourth and the third.
Okay, good afternoon, colleagues. Welcome back. Are you awake?
Let me just make sure.
Are you ready? Because we're flying to Cape Town. So I'm Renee van Wyk, and I'll be presenting a study that was completed by one of my Masters in Public Health students, and she's a qualified environmental health practitioner, chief EHP with the City of Cape Town. So the work is really based on the area that she works in, and what they're struggling with, and what they wanted, but more information. So this research also was directly beneficial to the City of Cape Town. Which way do I PowerPoint? Okay, sorry. I got it. Okay, so the big picture, really, what we wanted to demonstrate is the sewage that is visible in the streets and accessible, and which leads to exposure and big health. It doesn't help the existing health crisis. But this work is also positioned based on the SDGs, and there's the specific 3 of them, specifically those 3. The first one being health. Because the sewage leaks and poor sanitation contribute to diarrheal and respiratory diseases, and children, women, and the elderly that are most affected. So, in terms of clean water and sanitation, the SDG 6, Khayelitsha has it's got more than 400,000 residents facing recurring sewage blockages and inadequate fecal sludge management. They're also struggling with limited water and sanitation infrastructure, which undermines public health gains. So as much as we are trying to address the health side and the soft issues, it doesn't help if the hardware is not functioning properly. SDG 11 speaks to sustainable cities and communities, and yet we are 5 years from, the date that 2030 we are supposed to have achieved all these SDGs, yet we still have a long way to go. We're struggling with rapid urbanization and resource strain in informal settlements. And like I said over lunch to one of the colleagues, informal settlements are not going anywhere. And informal settlements is what we've been talking about for most of today. So, sewage, fecal sludge, mismanagement, it all speaks to the sanitation goal. So safe sanitation is not a privilege. There was a slogan, water is life, sanitation is dignity, is one of the slogans that the Department of Water Affairs then was using. But it is really, sanitation it's a cornerstone of healthy and sustainable communities. So that kind of speaks to why we're doing the study. So we wanted to quantify the incidence of untreated sewage spillage or sewer blockages in Khayelitsha, which is one of the biggest settlements, with quite a variety of housing types and informal settlements as well. Secondly, we wanted to analyze service requests logged with the City of Cape Town's Department of Water and Sanitation to estimate average maintenance and repair response timeframes to action or to resolve sewage spillage-related services. I just skipped all the literature because I think we've kind of already positioned this work. So the key findings in terms of spillage incidents versus blockages, the sewer spillage incidents is now indicated in blue, and the yellow is the sewer blockages. So as you can see, the two are quite similar. However, in 2020, there was that spike. And what happened in 2020? We were right in the middle of the pandemic at that time. So, did I also skip I'm sorry, just quickly step back. So just to give you a sense of what we were doing, it was a descriptive cross-sectional study. We included all 13 specific wards in Khayelitsha, and then we accessed the data. It's a secondary data study, so we accessed the service request or the reports of incidents from the City of Cape Town's SAP system, and we exported it to Excel and then to SPSS for analysis. We included obviously all complete records, and then excluded the incomplete or private property data. So also in terms of, we can go back quickly. Oops. Not that fast. Okay. Okay, so as I was saying, in 2020 there was a significant spike in terms of incidents being reported, and that can be due to several reasons. So in with this bar graph, we're trying to show the distribution of sewer spillage incidents versus the sewer blockage overflows between 2019 and 2021, with an increased spike in 2020, which ran concurrently with the pandemic at that time. Oh, this thing is so sensitive. Sorry about that. Okay, so then we looked at the response times, and there was less than 7 days, there were 7 to 20 days, there were 20 to 30 days, and then there were over 30 days. So overall, the results show an apparent increase in the sewage spill incidents from 2019 to 2020. Corresponding with the onset, I think that is the previous one, sorry. Then the cross-tab, sorry, no, I'm right. So the slight decline in 2021, we can also see the years are indicated there. In yellow, the 2019, that was just before with the onset of the pandemic. We were still relatively low in terms of incidents being reported. However, in 2020, there was a significant increase across all the response time categories. And there's a slight decline in 2021, suggesting an improvement in incident management despite the ongoing challenges. Now, what we didn't do here is we didn't look at the lockdown levels. So we didn't specify that, and that's perhaps something for further investigation. So in terms of the cross-tabulation that we've done here, it depicts the quarterly response times. Most incidents, about 94.6%, occurred during the third quarter, July and September, and were the lowest in the first quarter, January to March, across the years. So this trend suggests a seasonal pattern possibly linked to the environmental factors such as rainfall as well, and which may exacerbate infrastructure vulnerability during winter times, because we know Cape Town is usually during the winter time they have more rainfall. All right, so the significant findings here were then sewer blockages and overflows accounted for the vast majority of the reported incidents, with 526 out of the 546 cases falling into this category. And 399 of these incidents occurred in 2020 and 2021, which suggests a significant correlation between the pandemic and an escalation in the sewage-related incidents. But also, depending on the lockdown level, that may also have contributed to it and staff being on duty or not during that time. And more people were at home, obviously, because of the lockdown. So the discussion here for implications for Africa's future in terms of how to deal with similar situations in informal settlements is to strengthen urban sanitation resilience, and it speaks to the infrastructure that we have for sanitation. I think we also mentioned earlier in one of the sessions that we don't always plan for the influx of people, and obviously these systems, especially the infrastructure systems, are not upgraded. Wastewater treatment plants, the pipes, and all those kind of things are not. It's there for decades, and the pressure that we experience is because of influx of people, but also the behavior of the people in terms of waste management and other issues. So enhancing fecal sludge management systems, reducing health inequalities in informal settlements, and then, which obviously goes hand in hand with water, sanitation, and hygiene services. Accelerating progress towards the SDG 3 and 6, and then building knowledge for future pandemics. So the conclusion I want to make here is that there's a significant link between the pandemic and the increased sewer blockages due to the COVID-19 resource restraint, and then no significant associations with incident conditions or causes, highlighting systemic issues affecting response times, and public health. So the pandemic was just highlighting the existing systematic issues that we are struggling with as a developing country. The recommendations here then was to upgrade the sewer and stormwater management systems in high-risk areas like Khayelitsha, expand the capacity of sewage treatment plants, and I think some plans should be made to work towards expanding such, and then ensuring it doesn't help just to say, well, the system has been in existence for 20 or 30 years and we've not done anything. Ensuring regular maintenance of pump stations and sewer lines, and then targeted interventions to reduce blockages. Also public education campaigns to raise awareness about proper waste disposal practices would also be of help. And that is Ms. Lena Stufile, who has graduated with her Master's in Public Health, based on, this is part of the work that she did for that qualification. So that's the end of this presentation. Any questions? Mm-hmm. Yeah. Yeah, and recently there's been a lot of, there's been reports of a lot of vandalism taking place, manhole covers and things that's being stolen. And that picture that I showed earlier was actually officials of the city of Cape Town having to, jump across water puddles and so on. So they were looking at and responding to some of those reports to go and see what is happening in the settlement. Yeah. Oh, I've noted you. Yeah.
Okay, thank you so much. This was very interesting. And I'm smiling because what you basically were presenting was also so similar to my own research, and I'm focusing on the city of Cape Town. Yeah. So more of a comment than a question, rather. I recently spoke to a reticulation someone from the reticulation branch in the city of Cape Town.
Yes.
The pressing issue that he mentioned with essentially this problem of drainage, all of that, it's also the difficulty in mapping informal settlements.
Yes.
So for me, it's Joe Slovo in Malnerton area in
Yeah.
Cape Town and Danune.
Yeah.
Because of the proliferation of these shacks, all of these housing, illegal housing as well, it has led to a lot of illegal connections onto the drainage pipes. That is literally also not affecting just the rivers and the waterways, but also it gets so damaged and blocked. And I like what Doctor said in terms of what kind of waste. And to answer also partially that, in informal settlements, you find a lot of nappies, like a lot of
Yeah.
big. And then in
Yes.
urban areas, you find wipes. Like that's
Yes.
just one illustration that I found with my research. So this is
Yes.
such an important study. And I am also quite happy she got access to the City of Cape Town officials. Did she speak to them?
Well, she is a City of Cape Town official.
Oh, I was, okay, okay.
She works at the Mitchells Plain office.
Okay.
So she is a chief environmental health practitioner.
Okay.
It's part of a job description to respond to these, when the people complain. People
Okay.
complain. Yes, they report the incident, but she's not the one responding. She's responsible for how it affects their health.
Their health,
Yes.
okay.
So I'm so glad you mentioned absorbent hygiene products, which is diapers and wipes is a big issue now as well because it's not biodegradable. So it blocks up all the things, you know, and it just goes into the environment and it's not dissolving. It ends up in the water and in the rivers, where we don't need it. We don't need it there, so that is a problem. I'm familiar with Joe Slovo based on my M that I did many moons ago, and I'm also familiar with I don't know if the channel is still there, but the sanitation in that settlement was to the extent that kids were playing in the canal, and the excreta was directly deposited into that waterway actually.
Just one last thing is on urban planning, because I'm finding it's an important factor to consider in my own research. But also here, I don't know if you touched on it, or maybe also mapping out exactly where people are actively depositing the pollution, I guess.
Yeah.
Is that something?
So this specific project was based on the spillage and sewage incidents due to a broken pipe, due to a clogged drain, etc., being reported to the City of Cape Town. So it wasn't really about waste dumping or anything like that. It was specifically to the waters, the sanitation issue, the raw sewage that is flowing in the street, and that people have to deal with.
Well, thank you very
you.
much. I'm actually interested in one of the slides where you shown the relationship between the spillage and the blockage.
Okay.
I just want to know because
Oopsie.
the one
It's the
with,
next one,
yes,
this
that one. The relationship is linear. So I just want to know what are the variables, and if you add a different variable, will it change the relationship between the spillage and the blockage? Because when the blockage increases, the spillage also increases. So what are the variables that you
It
used?
was based on it was based on the description that was given when they reported the incident. So I can discuss that with you outside of this, if it's okay with you, because I have to double check. Thank you. All right. Last question on this presentation. Yeah. Yeah. Sure. That's quite difficult to answer because there's more than. At the time I was doing my master's, I worked in 4 informal settlements. Out of 240 informal settlements, there's 500, if not more now. So it's not just an infrastructure problem, it's a housing problem as well. So as long as we have a housing problem, informal settlements will not go anywhere. And we will still deal with all the issues. So it's like a domino effect. Or, one problem leads to the next. So housing, I think that's a starting point. In terms of percentage, I'm not able to answer you right now. But that's a very valuable question in terms of how to move forward. So the politicians will have to think very, very, very much in terms of that. So that was the last question on this presentation. I've got another one. Sorry?
Why did you leave out, exclude the private?
Because yeah, I think it was just for the sake of the study, because of the scope of the study. It's a master's in public health. It's not a full research program. So she was just doing a minor dissertation, and she just wanted to focus the project on specifically spillages that links to the work that she does. Thank you. Thank you. So you can put on the next one. It's the third one from the top. So we are moving from Cape Town to Gauteng, Johannesburg. The next presentation is on spatial inequalities in water and sanitation. We wanted to assess the risk in deep fluid informal settlement. The study is also a product of work of another environmental practitioner. You see, I'm selling environmental practitioners today. She's working for the city of Johannesburg. Well, she's no longer working for the city of Johannesburg. After she completed her study, she was employed by the Department of Health as a deputy director. So I'm sure that the work that she's done here also influenced them hiring her. So Ashira Ruknanan was the student, and then my colleague Herman Meiberg, we were supervising her. So this work, let me just see, there should be a picture. I went too fast again. There we go. The big picture here is limited water points, communal standpipes, and communal toilets. This study was based on also looking back what happened during COVID-19. At the time when the study was conceptualized, she was an environmental practitioner responsible for the settlement. And it fell in her area of jurisdiction and that she needed to do the work. So we wanted to look at what wash infrastructure was present, water and sanitation and hygiene. And obviously there's limited water points, shared communal standpipes, and then also shared sanitation, which can add a lot of issues. So there's issue of coverage and the condition of the sanitation systems as well. So with this said, socioeconomic inequities and inadequate wash access amplified the pandemic vulnerability. And so our study wanted to measure how the lack of water and sanitation together affected the spread of COVID-19, assess how the lack of water influenced the spread of COVID-19, and then assess how poor sanitation influenced, or the lack of sanitation influenced the spread of COVID-19. And I've got, obviously, I think these numbers would be familiar to you if you are watching the space in terms of, I think most of us are familiar with the COVID-19 impact, so this is what we want to show with that slide. In terms of the local challenge, informal settlements. I think I've staged that already in the initial slide. So again, the pandemic exposed the critical link between hygiene and infrastructure and disease control. Well, this was also a cross-sectional study in Diepsloot, and then we had 344 participants recruited from health facilities, the healthcare facility or clinic, using convenient sampling strategy. And we included only, obviously, respondents that were 18 years and above, and people who were living there for more than 2 years within. So the people would come to the clinic, and she just, obviously, she started recruiting participants there at the clinic as they were waiting, instead of going to the households. Then also we obviously excluded people who were living there for less than 2 years, and all minors were excluded. So it was it's a quantitative descriptive study, and I will show you the Pearson's correlation and the logistic regression outputs. Okay, just quickly the demographic profile of the participants. The majority were female. Majority were female, because I think the guys don't go to the clinic. Most were between 36 and 45 years. Mostly low formal education levels was prevalent, and then most participants were single. Unemployment dominated the sample, with obviously 66.5%. And then many residents lived there for over a decade. Well, that was one of the inclusion criteria was more than, they should have lived there more than 2 years. But the most residents were living there for over a decade. Then, in terms of the Pearson's correlation among WASH and the COVID-19 variables. So I've listed some of the variables. It was impossible to list all of them because we want to tell a story. So we have the ease of water collection, government measures to provide additional water, ease of accessing community or communal toilets, toilet safety, water access, ease of practicing social distancing, and also the government support. And so there was a strong, so what you see on this side is a heat map. So what we saw was a strong positive correlation observed between the WASH accessibility and the perceptions of government response during COVID-19. The stronger correlations are shown by brighter or more intense colors, and the positive correlations, which is closer to 1, to +1, indicate that as one variable increases, the other it tends to increase. For example, better water access was associated with improved sanitation, and the negative correlations suggest an inverse relationship. For example, poor sanitation linked to higher disease prevalence. So that's that slide. Then we move on to the logistic regression for water access. Apologies for that. The respondents who agreed that water facilities were provided were less likely to experience water access. And areas relying on certain main water sources were also less likely to report water access difficulties. And then other factors showed no significant association. So the ones highlighted in red was significant because it's less than 0.005. So you can see on the last column there. And then the rest were all no significant association. The logistic regression for sanitation, then there were significant predictors of toilet access, included availability of toilet facilities, the type of toilet, the ease of access, and servicing frequency, and you can see those are all highlighted. And then the distance and cleanliness were not statistically significant. And then, so the lessons here from from these results is that 59% of the participants were affected by COVID-19 exposure or infection. Access to water and toilet facilities significantly influenced the health outcomes. And despite the government's efforts, wash access remained insufficient, intensifying community vulnerability. So the data was collected after COVID-19, but it was just to find out what was those, hence the inclusion criteria. What was the experience of those residents at the time during the pandemic? So the significance for the future, there's an urgent need for pro-poor urban wash policies prioritizing informal settlements. And as we were saying, why go the policy route? It's not going anywhere. So we have to put something in place so that we are able to address the challenges. Strengthen local participation and education. The University of the Village. We need to enable them. And to build resilience against outbreaks. And that can be through risk communication strategies, etc. Invest in public-private partnerships to expand infrastructure and create jobs in the WAS sector. And explore governance readiness and innovative financing models to sustain equitable water and sanitation services. And with that said, I think, in terms of the significance, you would note that it's not just government's responsibility, public-private partnerships, as well as the community, they also need to take responsibility. There shouldn't just be one entity that is responsible for it. Sorry, here we go. Okay, key takeaways. Prioritize water and sanitation provision in Diepsloot, and I think here there should be ways of looking at what is in place and what is the easiest way, or can I say more creative ways of making sure that there are water and sanitation in Diepsloot. So we also, what I wanted to say is the building of capacity of health professionals like environmental health practitioners, nurses, all the health professionals that gives the services would also further, strengthen community health. Focus on disease prevention and health education with informal settlements instead of just responding to outbreaks, it's responding to pandemics. Conducting research on local government readiness for future outbreaks is also of significance. So, oopsie, let me just go there. Okay, all right. I think with that, just wanted to acknowledge them again, Ashira and Dr. Meiberg, for the study. I think I did conclude key takeaways, yes. So, questions? More on? That's right.
Now here we are talking of an informal settlement. And is it really possible now for government to go and improve water infrastructure in it? Remember, we've already, categorized it as informal, meaning that it's not supposed to be there. So if we make a recommendation to say, let's go and how possible is that? That's one. My also observation is that these informal settlements are big business for politicians. That's one thing which I've observed, not only in South Africa, almost in many countries in Africa.
Yeah.
I can give you in Kenya, politicians make big business supplying water. South Africa, do you know how much they charge per Bowser just to go and deliver water in an informal settlement? And then you say provide water facilities. Will that be possible? So
Well,
you can see as researchers, we need to reflect, especially on these issues. How
True.
can we make sure that whatever we are proposing should be taken on board? And this is why at times, all the time, we are saying, no, they are not following recommendations, is because what you are recommending is anti their money-making machines. I attended one meeting in Mamelodi,
Yeah.
and there was someone who was talking, no, the problem we have is just the taps. They need to sort the taps. That person was followed it. He would say, don't come again and attend meetings. So I'm just giving this comment to say, when we do most of these researches, let's also look at the reality of what is really happening in our communities.
Yeah.
And then find ways of addressing those challenges.
Yeah.
That's my
So
comment. But it's
That is what's really happening in those communities. But the Constitution says what? Every single citizen has the right to a safe environment and water and sanitation. And now, the very politicians that Dr. Lunga is referring to, we are doing this research so that they can take note, you know, because we do the research, we take photos, we do videos, we make graphs so that they can understand, because they're not going to read any of these reports or dissertations or whatever format you are publishing it in. But I guess, you know, doing the work and presenting it at the right platforms and hoping that there would be a response and somebody sensitive enough to think of responding to some of these and finding ways. As much as they live in informal settlements, they still have a right to clean water and sanitation. And we have to make peace with the fact it's not going in anywhere. They have a right to basic sanitation and access to water. So I've noted your hand. Even not in an informal settlement, a couple of weeks ago, you had Joburg residents, you know, toy-toying because there's no water. And so now the political playing field was buzzing because some political parties went and took water so that people can get water. But the municipality, I'm not quite sure to what extent they've responded.
yeah, thank you. And any comment, I mean,
I
question?
think she had a question. Front row.
Thank you for that presentation. And just a follow-up comment on what Dr. Longa is talking about. Does this call us to move from our places of comfort as researchers to the areas of activism, research and
Yes.
activism? And I remember one of my mentors telling me that HSRC is a platform for us to also do these public presentations on.
Yes.
Thank you.
Thank you so much. Thank you for the floor and opportunity. Okay.
It's not 15. Ooh. Eh? Madirongarsi.
Yes. Where do I point? Okay. I can start, right? Good afternoon, everyone, and greetings to young adult researchers, innovators. It's a great honor and a privilege to stand here before you all and to present. Thank you so much. Yes. Okay. Thank you. Yes, it's really a great honor and a privilege to stand here before you all and to present to you my project that is titled Assessing the Impact of Seasonal Variation or Changes on Spring Water Quality, Safety, and the Human Health. This is a study of Thulamela Municipality. My name is Madonga Rupa Teresa, and I'm from the University of Limpopo, South Africa. And those are the co-authors of which I've been closely working with. Due to time, I'll skip. So the aim of this project was to assess the impacts of seasonal change on spring water quality, safety, human health in Thulamela Municipality. And the purpose why we generated this study is because there is lack of scientific evidence into the local communities. And, sorry. I'm not sure if this is the same. Okay, I'm not sure if this is the same. Okay, it's fine. I'll just focus on this one. So the purpose of this project was to generate scientific evidence that informs the same water use, public health awareness, and policy interventions into the rural communities. What we have witnessed is that many people in the rural communities, they're heavily depending on the untreated spring water, and that is heavily affecting their health. And subsequent to that, we have a variety of diseases, and that is affecting, that is due to the untreated spring water. So the first objective of this study was to analyze the seasonal change in the physiochemical, microbiological of the spring water quality. The second objective, we investigated the potential health risks which are associated with consuming the spring water. And the third objective, we're going to provide the recommendation for improving the monitoring management and the policy for rural water safety. And these are the related key literatures from the various of the studies which have been conducted. First, this study was conducted or carried out into the Thulamela Municipality, Limpopo. So we've targeted a total of 41 spring water and from the various of villages. So this was really huge. So the sampling, we collected a total of 164 water samples. 82 was for dry season and 82 was for wet season. So we analyzed parameters such as physical, microbiological, and the chemical. So for the physical parameters, we collected them on site using the portable multimeter. For the chemical parameters, we analyzed using the ICP-MS. And for microbiological, we used the traditional method, that's a membrane filtration method. And further on, we checked the risks assessment. For microbiological, we used the QMRA, and for the status, the average status of the water for the Thulamela, we used the water quality index. And further to that, we also looked into the chemical risks of the physical parameters, and then we used the USEPA method because we wanted to understand the health risks which are affecting both adults and the oldest. And after that, the results which we found, we compared them to the existing literatures and the WHO and the SAN standard guidelines. For physical findings, we found that all of the parameters, they did comply with the standard guidelines for WHO and SANS, except for the turbidity. So we also witnessed that there was a seasonal variation of fluctuations which was observed, where wet season was more compared to the dry season, and this was due to the runoff and the sediments inputs which were near the sources. And from the graphs, you can see that the TDS strongly correlated with the EC and the salinity as expected, and there was no significant seasonal difference between the parameters for both seasons. And for the chemical parameters, we found out that all of the major metal cations, they complied with the standard guidelines of WHO and SANS for both seasons. However, it was a different case when it comes to the major anions, because we found that only 4 of the parameters which were studies, they complied with the SANS and WHO for both seasons, and that was fluoride, chloride, nitrate, and sulfate. However, it was also a different case for the bromide, where sample number 1, number 23, they exceeded the standard guidelines, and this was from the observed runoff, mineral dissolutions, and the human activities. And further to that, we also found that the phosphates also exceeded at sample from 16 to 18 for wet season from agricultural. And lastly, for nitrite, it also exceeded with almost 22% for dry season and 32% for wet season. And this was from the fertilizers and the sewages. So we also analyzed for microbiological contamination, which raised a very serious concerns because all of the parameters, they exceeded the standard guidelines of WHO for both seasons. So indeed, they did show a serious concern, most especially to human health and the community, which is depending on the spring waters for survival. So the study found out that the total coliform were present in all of the sampling sites. So there was no any samples which recorded 0. So this was really concerning. So for fecal coliform, we found that approximately 85% for dry season was recorded, and for 95% for wet season. And E. coli, it recorded low results, but still it was really concerning. Whereas we found that 34% for dry season and 58% for wet season. All in all, we found that the wet season was more compared to the dry season due to the poor sanitation which was observed into the study. And there's a need for the intervention and monitoring. And moving further to that, we also assessed the quantitative microbiological risks. So for the infection risks, we found that for the adults, it recorded 20% to 70%. However, for the child, it recorded up to 99%. The reason is because child, they mainly have small bodies. So their immune system is weak and also vulnerable. So if they take higher of the amount of the dosage, this increases the exposures to their health. So hence why you see the results for the children, they are more compared to the adults because they are vulnerable. However, for the health risk sites, the sites which recorded the highest of more than 90%, it was sampling number 24, 34, and 35. However, the sampling sites which were critical hotspots but recorded a moderate of 60% to 80% was sampling number 3, 4, 10, 17, and 31. However, for the lowest or almost no recorded of the quantitative microbial risks were high, so at least 60 or 50% recorded low for the microbiological risks, more especially on the adults. In the end, we do recommend a regular monitoring and an immediate intervention. The study also assessed the heavy metal analysis. So most of the parameters, they complied with the standard guidelines for Wu and Sons. However, we had only 3 parameters which exceeded the standard guidelines, and that was chromium, iron, and silicon. And they posed potential concerns where for the health risks for chromium, if the community continues to use this water for a longest time, they can have effects such as skin irritation for chromium, whereas for iron, they can experience stains or long-term health concerns. However, for silicon, they can experience the eye irritation or lung cancer. So the samples which recorded the highest concentration was number 37 for the wet season. Although we recorded low concentration for both wet and dry season, the ones which exceeded the standard guidelines were concerning, and these can affect negatively the community, most especially the rural area that are depending on the spring waters for survival. We also assessed the human health risks assessment. So we looked into the 4 major parameters which are associated with the cancer risks exposure. So the carcinogenic risks ranking were from high to low, all the way from chromium, and then lead, nickel, and cadmium. So they all indicate, okay, the chromium and lead indicated potential long-term exposures concerns. So for chromium and lead, they both exceeded the safe limit for both seasons, for child and the adult. So the hotspots which were concerning for chromium and lead were number 8, 18, 24, 34, and 35. And the values increased sharply on the wet season. So for the nickel exceeded the limits for the child, and this was due to the high exposures, but only complied with the adults. This was for both wet and dry season. However, the cadmium was the one that remained within the same limits across all seasons, and it did not show any concerns. And we also looked into the status of the water quality of the Thulamela. We found that the water was not safe. It was not good, it was not excellent, it was not poor. However, it was just in between. So further to that, the implications for the African's future. So the seasonal and the climate-driven changes threatens the spring water safety across Africa. And the main rural areas still rely on that untreated water for survival, which increases the health risks. So it's important to get to invest into the smart and climate-resilient water systems, which can secure the African's future. So having a strong community engagement and data-driven policies is important for sustainable water management. Yes, we did have the uncertainty and limitation to this study just because we only assessed for dry and wet season. We also recommend other studies to also look into the interannual where we get to understand how the other seasons are affecting the safety, quality, and also the human's health. And we did not cover the whole of Thulamela because it's large. So there were only certain selected spring water. So this does not represent the whole region of the Thulamela. And we also assessed the microbiological fluctuations, which can change so rapidly. So a constant monitoring is needed so that we can have reliable results. In conclusion, the recommendations. So the study recommends the improvement of the water management and protect the spring water, and to invest into the rural water infrastructure and the sanitation. The study, secondly, also recommends the regular monitoring and to track the seasonal changes so that we can also educate the community about the household's water treatment, because the community perceives spring water as safe. So they tend to avoid those household water treatment methods, of which they can be able to assist them into protecting their health. So, of which is something of which I'm really quite interested into is to look into the digital solutions on how we can be able to manage the water or spring water in the rural community, or how we can be able to use the integrated models where we can be able to communicate with the community since they're not well informed about the water that they're using. So I would love to acknowledge the following: University of Venda, University of Limpopo, my funder, Water Research Commission, and my supervisor, Professor Matiwa, and my former supervisors, Professor Dr. Joshua and Dr. Duruoju, and of course the Tulamela municipality. And that's all.
I'll just let others start.
Thank you, Doctor. This was very interesting again for someone who's also studying water. So my first question, I was actually Googling what are the uses of spring water. So my question firstly is on the aquifer below this informal settlement. In terms of you testing, did you actually consider the aquifer below it? Because in my understanding, spring water comes from underground. And you were actually, if I'm understanding this correctly, you were testing, sampling the water on the surface. So there's also this thing of studying vertical as well, of like looking at the aquifer. I'm just wondering if that's something you came across, because have you actually asked yourself, where is this water coming from exactly? And it goes back to going to the root of the problem, because it's like saying there's contaminated tap water, but maybe the pipes are rusted, or it's something similar to that. So just a thought or question on, is there an aquifer below this informal settlement? And yeah, I think that's that. I'll stop there with.
Can we take another one? Just a moment. Anyone else? Okay, let me start. Yes.
Yeah, thank you, Doc. I was just looking at I think the first results when you were assessing the water quality from the 2 seasons. I saw a statistic that says no difference.
No strong correlation?
Go back to the
Yeah.
slide.
Yeah.
Yeah.
Which one?
Oh, yes, yeah. Go again. No. Again. Move. Move again. Yeah.
Yeah.
Is
Yeah.
this the one?
Yes.
Yes.
So this difference is significant enough to contribute to because your conclusion is that there is higher risk associated with two different seasons.
I'm not sure if can you please try to elaborate, or someone can elaborate? Because this is us trying to check the quality, the average quality of the spring water that we sampled into the Tulamela.
Okay. No, I was just trying to link this to the conclusion. I thought there was a time when you said it was not so significant. But maybe that significant is already, it warrant,
okay.
Yeah, okay.
Okay. Can you answer a question?
Yes, I can. So first, my interest was just surface water, right? So hence now I've emerged more to the groundwater quality. Yes. So groundwater and the variations and the future simulations is something of which we are looking into now immensely. And that is also not spring water wise. However, so it's something of which I would love to look into as part of maybe my papers.
Sorry, can I follow up? The other first question I had was, I just remember now, what water standards are you actually looking at? Because for rivers it's different, for tap water it's different. And I don't think you actually mentioned it at the beginning.
WHO.
No,
It's like the way.
you mean the standard guidelines? You are asking about.
trying to understand to what safety standards is spring water classified under. It's not river, it's not like water bodies like that. Is it tap water? Is it, where exactly do they fall under? So it's considered that. Okay, then I go back to the aquifer, which is, okay.
Exactly.
Thank you.
Are you okay?
Yeah, no.
Okay. Let's take the last one. Then prepare for 5 from me.
Thank you for this. So from past experiences and doing work in water, from doing water quality monitoring in the groundwater, what we found is different areas, if there's contaminated dams or rivers, that contamination leaches into the groundwater. And we found where we find E. coli in groundwater, in borehole water. In certain areas, and then also with surface water, it depends also with where the spring water is, because does it link with the river? So it'd be good to do a special GIS mapping to see your river, or your spring water, where it is, and also where the human activities and engagement are, for you to see with your hotspots where you're getting your contamination. So I'm not sure if you've done some GIS mapping and identifying your different hotspots, because that gives you that added identification. It's just something to look at.
Yeah, we did not do the GIS on this one, but what we did was to look into the spatial distribution, like checking the hotspots where people are mostly affected, and how we can be able to easily communicate with those people who are affected or educate them. Yes, that's the only GIS that we did.
The last one, question?
Hello, just one quick question. Thank you for your presentation. I don't know if my question is out of context, but you did mention that the quality of water has an impact on health.
Yes.
So and then you mentioned in your recommendations that regular monitoring is necessary. So I wanted to know if there's any multi-sectoral or intersectoral collaboration with the Department of Health or healthcare systems, because I imagine they're well positioned to pick up early signs of disease outbreak that you could correlate to contaminated water, and that could serve as one source of monitoring for the other sector to react and treat and educate. So I wanted to know whether or not that intersectoral collaboration is something that is happening, or is something that would be feasible in terms of your recommendations.
Yes, but immediately after conducting the study, we collaborated with the Water Research Commission that was working with one of the villages, right? So for me, it was quite intriguing to extend. I want to understand, like, how are they communicating with the community, and how are they collaborating with the stakeholders, right? Because I was just a master's student, understand? However, I did get to learn a lot. I also integrated or communicated with the stakeholders, and then I was also given opportunity to facilitate. So I would say they do collaborate to make sure that effective awareness or people are being educated. Just because it's rural, they're not informed, and them educating about the water that they're using is quite crucial to them. And they did take it further to also look into other villages. Yeah, unfortunately, I also had to look into other projects, but yes.
Thank you so much. Are you ready for my questions?
You asking?
No, I'm joking. Actually, you can take a seat. Let's give a round of applause. Definitely, this was a good, quite presentation. Yes, but I will engage with you, especially on the recommendations. I could tell you are young and you are already thinking of digital, whatever. But if it were me, I'll go to the traditional ways of purifying water, which you were talking, that there were some traditional methods and so forth, so that I see what are these methods? How best can we improve them? Because if they are already using them, they are cheaper, isn't it? So it's a way of trying to find how best we can work perhaps with the CSIR who are into innovations, things like that. That's the route I would take. Thank you, though, because it was quite eye-opening. Let's welcome another presentation by Dr. Agneta Nyambudi, University of Pretoria. She will be presenting on narratives of change, climate change, locally transmitted malaria in Nairobi, Kenya, and its environment. Over to you.
Thank you very much, and good afternoon to us all. I think we need to now go into stories. And let me start with Gideko's story. Gideko hails from Karatina, and he has conducted, let me go into the anthropology part. I hail from Karatina, but have conducted vast research on malaria and climate change, especially at the Kenya Medical Research Institute, Kisumu, Kenya. Kisumu, Kenya is mainly a malaria endemic area. However, I'm currently shocked to realize that local people in Karatina, that is at the foothills of Mount Kenya, are now experiencing locally transmitted malaria. This is an area which previously was considered a malaria-free zone. I discovered that malaria is being experienced, not being brought by people who have traveled from malaria endemic areas to this previously malaria-free area. However, they are now experiencing locally transmitted malaria, transmitted from within the locals. The shock of my discovery is when, my discovery made me take up the mandates to explain the phenomena to the health workers at the health facility. My home area had previously enjoyed the snow-capped Mount Kenya, whose slopes are now drying up. A place that formerly had many rivers flowing through it is now suffering from incidences of water shortages and rationing. Settlements have taken over the previously densely forested mountain. I therefore explained the biology of malaria mosquitoes to the health workers at the health facility, the local health facility. And I told them how at 18 degrees centigrade, the parasites produced too slowly to mature during the mosquito's lifetime. However, at 20 degrees, the mosquito parasites reproduced quickly and easily. The increase of 2 degrees centigrade has made a huge difference. So we are moving from Southern Africa to Kenya, Nairobi. Nairobi is considered a malaria low-risk area due to its location at 1,700 meters above sea level. We experience the cold seasonal temperatures, and it's an urban habitat. And all these factors have continuously limited the development of dominant vectors that transmit malaria. However, it experiences high malaria incidence rates against the backdrop of the high health facility utilization rates among residents. A previous study had shown that this incidence rates was as a result of mobility. But in the middle of my study, I realized that there was something different. There were people who had not traveled, yet they experienced malaria. So where did this come from? The objectives of this study, therefore, include exploring the local narratives and practices, that is deforestation, urban expansion, and changing climates, and how they are contesting the new environments in Nairobi and its suburbs. I also endeavor to examine both the health worker and resident perceptions, their experiences on climate and environmental changes that have led to the spread of malaria in previously malaria-free areas. And last but not least is to determine how health professionals make sense and respond to these new realities on the ground, and what does it mean in terms of health investment and response. This was mainly an ethnographic study, but a quick ethnography for that matter. And the first aspect was to start with my own story, having grown up and brought up in Nairobi, but having constant travels to the malaria endemic areas. Then I followed up with several informal conversations with the health practitioners and residents residents who had formerly stayed in Nairobi, but also consistently commuted to the malaria endemic areas. But later on, I also conducted informal conversations with residents who had not traveled, yet they experienced malaria. I chose to use the Singer's socio-ecological framework. For this framework weaves together the personal memoirs, the oral histories, the field-based dialogues to reveal how rapid urbanization, microclimatic shifts, and human mosquito encounters co-produce Nairobi's emerging malaria landscapes. I will look at Babu's narrative, but from a very short perspective because I thrive on stories. So Babu grew surrounded by indigenous forest cover, which included trees and vegetation that provided food, medicine, and a place of prayer. The forest and vegetation cover provided edible medicinal roots, leaves, flowers, seeds, and fruits that provided even the luxury of food. However, this has changed. With the expansion of the city, that is Nairobi, the previous forest and vegetation cover has been cut off to provide an environment for the growth of the city and urbanization. This has been a concern to the government since the cutting down of trees has continued and it has had a tremendous effect on the city. However, what does the government do? As time passed, the government noted the extreme weather conditions affecting the nation, advocated for afforestation, but with no consultations with the people on the kind of trees to plant. The village university. So the government comes in, they decide which trees we are going to plant for the people. So they proposed planting exotic trees, which eventually would mature quickly and were logged for timber and to support the Industrial Revolution and for individual benefit of a few. For example, the Mau forest, which was densely populated with indigenous trees, is currently almost bare, apart from the exotic trees planted for economic purposes by a few leaders. So this was the narrative of Babu, just in short. This is a man in his late 60s who has lived in the outskirts of Nairobi and seen the city grow up to the hinterlands. And he laments how deforestation is taking place and eventually how afforestation has come in. And his lamentation is that they were not involved in the kind of trees to plant, in the kind of vegetation to incorporate. Going back to Giteko's story, his story reveals both the expanded footprint of malaria and also the local everyday consequences and recognition of new vulnerabilities. Giteko noted how the rise in temperature in previously malaria-free areas
has now provided breeding grounds for mosquitoes, which are now transmitting malaria. He further states that when it rains, the temperatures are high, and the place provides a perfect breeding ground for malaria transmitting mosquitoes. This new revelation to the area that was previously malaria-free has had consequences on the population because their lack of immunological defenses to hold the parasite at bay has had several consequences which have been so severe because they had immunity that is expected, they do not have it. So it has led to death. Narratives from the health personnel. One of the health personnel mentioned that traditionally, we had malaria in Nairobi, but mainly as a result of travel from malaria endemic areas back to the city. The most notable seasons when our clients experienced high cases of malaria were in January, February, August, and December. And this was mainly as a result of travel back from malaria endemic areas. However, I have come to experience a number of cases that test positive for malaria without history of travel. This has continued to shock me, says the health personnel, even though recently we have experienced lots of mosquitoes during rainy seasons, and maybe some of them transmit malaria, but we are not sure. Discussions that have gone through over the time is that as the environment and the planet continues to warm up, global warming is taking place. It has opened up most places for malaria and other related infections that are putting billions of people at risk by the end of the century. And the priority should be able to support the most vulnerable people in adapting to climate change, even as efforts to mitigate it continue. I had talked about the herd immunity. There should be an effort to address the impact of weather disruptions on humanity. And this calls for an interdisciplinary, transdisciplinary approach, including collaborations among climate scientists, social scientists, public health experts, International Forum of Indigenous People, and local communities on climate change and other specialists. Anthropologists can contribute to a larger effort by thinking about and providing further support for an alternative global system, one committed to meeting people's basic needs, promoting social equity and justice, fostering democracy, and ensuring environmental sustainability. To conclude, we are experiencing shifting geographies when we speak of malaria today. And these are no longer understood solely from the mobility perspective, but we need to analyze them through the contested ways in which people are constructing the environment afresh, how they are representing the environments, and how they desire to claim back the changing environments. And as I had said, there's need for collaboration, collaboration, and collaboration. But the beauty with anthropology is that we provide a long view of how cultures and environmental changes. We provide the contextual, the local, and the critical understandings of how human lifestyles contribute to climate change and how it impacts life on the planet. We need to shift the lens from understanding individuals, in particular locals, to large-scale analysis of structural inequalities and violence that we have been speaking about this afternoon.
Want to show us the recommendations?
Sorry,
to acknowledge my interlocutors. The Andrew Mellor Foundation, which has been sponsoring my research. The Center for the Advancement of Scholarship, University of Pretoria, and my mentors, Professor James Obude and Professor Mwazi Mwanazi. Thank you.
Thank you so much. Any comments, any questions? Actually, your stories were talking of reality, and I enjoy, though I don't know how to write stories, but I enjoy them a lot. I have a colleague also who do this kind of research, where they, provide these narratives, because they are more holistic. They tell you, in monitoring and evaluation, that's one technique which you use when you want to see change over time, where you ask someone, can you tell me how are things, and they start narrating, and you can see change, and you can also measure impact. It's a way also of measuring impact.
Thank you.
Doc, just to echo what Dr. Long is saying, I liked your approach, the story approach. I was thinking from the story methodological kind of approaches to story journals. Is that possible?
It is.
I think let's run away from these Western journals and focus on our storytelling kind of journals. That's my bit.
Actually, I have an upcoming paper, just looking at integrating stories in social science research. Yeah.
Sure.
Thank you.
Thank you so much. Let's give another round of applause. Thank you so much, Dr. Kineta.
Thank you.
We want to move, because we have quite a number of people. I think we are the ones. Can we have Selelo? You are the next one. He's Dr. Selelo. Sorry, but because I work with him, we call each other by names. Yes. So Dr. Selelo Matmolane will be presenting on climate inequality and the elusive promise of water access in Limpopo province, an integrated triadic conceptual review.
Good afternoon, colleagues. I hope everyone is well. As introduced, I'll be presenting on the issues related to climate inequality and what I term the elusive promise for water access, focusing on Limpopo province. And this presentation and the whole study draws on interdisciplinary literature, climate evidence, and a governance analysis of policy and other related studies to answer the question of why water security persists, not only as a technical issue, not only as a technical and environmental challenge, but also as an issue of justice. I'm not sure. It seems to be temperamental. So, yeah, there you go. Okay, yeah. So the thought and the basis around this study is Section 27 of our Constitution, And when I say our constitution, I mean South Africa's constitution, right? It gives guarantees to everyone to right to sufficient water. But, and maybe controversially so, 30 years into the democracy on the new dispensation, political dispensation, we have rural communities in Limpopo province still trapped in severe water insecurity. And the question we have, or the question I have is, can we bridge the gap between the constitutional promise and the lived reality? The lived reality, of course, is that we have communities in several of our municipalities actually still having no access to reticulation systems, water infrastructure. So that dream of water access for those communities is very far, as compared to those that are living in peripheral towns or closer to the towns, or the major towns in our province. They have access to those water infrastructure, but most of the time the taps are dry. And those who live in Joburg might also bear witness to what we are seeing. But of course, let's not lose track. The focus of the study is Limpopo province. Over 31 million of South Africans, just a quick statistics, over 31 million of people in South Africa live in rural areas, and over 80% of those lack adequate water infrastructure, water access. And for me, that is frightening. And this isn't just an issue of service delivery. It's not a service delivery problem, but it reflects where we come from. It reflects historical injustice, inequality, institutional fragmentation, and of course, it reflects the issues of climate change and climate vulnerability impact. And in this study, the objective for us, or for myself, was to examine how institutional fragmentation, historical injustice, and climate vulnerability interact to produce and maintain and sustain water insecurity in Limpopo province, and analyze why decentralized governance models have reproduced rather than enhanced service delivery. Instead of empowering communities, I think it has often shown us to reproduce exclusion. And of course, the third objective is to identify barriers to equitable water access across multiple dimensions, looking at distributive, procedural, and recognition of justice, and that's the basis of our methodological approach. And of course, a quick synthesis of evidence-based principles for justice-oriented water governance reform that centers on equity, participation, and of course, accountability. So in short, I'm asking not just the what is failing, but why and what can be done differently. So those are the questions that we ask. So we might know what is failing, but why is it failing? And going forward, what can we do? What can we do differently? I think from my 8 minutes, I won't dwell much on my key literature, but of course I refer some studies that looked at apartheid water legacies and post-apartheid reform gaps. I think quite good literature on that, delving deeper into law and the justice orientation of this study. And of course, governance fragmentation, and I also look at rural inequalities in water access. So here we are talking about the urban and rural divide. So contextually, to analyze these dynamics, okay, it's gone again. To analyze these dynamics, I use an integrated triadic framework linking structural injustice. Okay. I'm sorry, colleagues. I'm just pressing it one at a time so that it doesn't jump and get away from me. Okay, yeah, so this is the contextual framework and the methodology. So I adopt an integrated TEDx framework linking structural injustice, history and policy, institutional governance, who decides and how do they decide? Do they involve communities in participation? And of course, I look at environmental stressors, that's climate vulnerability, and other climate shocks. These frameworks, of course, are based on the polycentric governance, environmental justice, and political ecology. And of course, to do the review, the approach was an integrative review, a systematic synthesis of peer-reviewed literature, policy documents, and that's just a schematic of how the data was sourced and analysis process. Key findings, there's a huge urban and rural divide, and it's very stark for everyone to see. Urban centers in the province have 88% to 92% infrastructure coverage, so they have access to water and sanitation infrastructure as compared to those in the rural areas. Okay. So you can see the urban centers being Polokwane and peri-urban a fair bit better, but rural remote areas are just between 12, they're very below 12, I think. And of course, this reflects 30 years of post-apartheid underinvestment in rural areas, the continued underinvestment in rural areas. In making the situation worse, we have climate change as a risk multiplier. Climate change doesn't only create governance failure, right? So the systems are not failing because of climate change, that's what I mean to say, but it exposes it, right? Between 2014 and 2016, in the study area, we had rainfall, we had episodes of drought. I think people would remember Mopani being declared a disaster area. But also, we had a drop of up to 30% in terms of rainfall, and dam levels, of course, had dropped significantly in certain areas that the water infrastructure was unable to actually pump water upstream to communities. So that is not climate change, but creating failure, but it's exposing those failures. And of course, I would love to, I don't know, my guy, if maybe you can help me, because I would like, yes, I would want colleagues to see this slide. Quick projection, starting in '94, we were on around 530 to 540 millimeters of rain per annum. And if you look at between 2014 and 2024, we are just around 440, 450, or just above that. And if you look into future projections, in 2060, we will be around 380. That's a huge reduction in the rainfall in the province. I think it's 380, just to correct, and that's below sustainable threshold for most of agricultural crop production. But of course, there's more than that in terms of impact. Urban centers, we find that urban centers can buffer shocks. Rural communities cannot. So climate stress depends existing inequality. So as those in the urban areas are able to cope because they are protected by access to infrastructure, rural communities are further exposed. Okay, next. I will rely on you to go for me. Right? Yeah? 1 minute, okay, quick one. Fragmented governance, there's a number of water authorities in the province or in the countries, but overall we have duplication and gaps in terms of accountability, and the fragmentation has of course encouraged duplication, and in many instances it has overwhelmed under-resourced municipality. I think many of us have had the cases where the Auditor General or the South African Human Rights Commission would comment on the issues around inability of certain rural municipalities to provide services to the communities that they're expected to serve. So who will be there to protect this community? And that is a challenge around fragmented governance. Next, please. Okay, so this is just around the cost recovery. You pay for the water that you use, and it's important because policy design matters, right? In rural households, those who have access to the infrastructure, they receive 6 kiloliters of free basic water, and about 19 liters per person per day is required, but typical rural needs are 15 to 20 kiloliters, sorry. And beyond this allowance, the tariffs kick in. And in many instances, the tariffs are so exorbitant in terms of the usage that rural household cannot afford. In certain instances, I found that it jumps between 400 to 600%. And for poor household, I would dare say this transforms a constitutional right into a marketable commodity. And those who are from those areas, those who are from the rural areas, would at least know one person that is a water tanker vendor and they're engaged. So the water has been commodified. But what about the constitutional right to those communities? And of course, in this instance, they are forced to reduce their consumption. They have to rely on unsafe sources of water, and this is water from streams. I mean, today we have heard about springs and access to unclean, safe water. We have documented evidence of communities using streams for doing laundry, for doing household chores, for actually drinking. Of course, it's not something we can display here, but we have documented evidence of that. The opposite of that is to accumulate debt, is to spend money that you don't have to purchase water. So a right-based system becomes a pay-to-drink, a pay-to-use model. And that's not good enough for our rural communities. Next, please, quick. Service delivery failures. I think I have one example here around what COVID showed us. During COVID, we had emergency tankers that were delivering water to communities, but what they did, the tankers that were meant to be temporary have become a permanent feature in our communities. And I'm from Limpopo myself. I'll be happy to tell you that the tanker comes on Tuesday in our community. There's no water, right? And the problem with that is that it signals planning failures, right? Maintains neglect and long-term misalignment of priorities. And the danger of this is that there is an integration, an expectation from those that are providing these services through the water tankers to continue benefiting from this. So in certain instances, the conversation we had with the rural communities as part of another project was that those who have access to the, let's call it a tender, but facility to provide water to the communities have interest in maintaining the status quo. So there is infrastructure sabotage in terms of trying to fix. So that's what neglect will show us. Signals planning failures that cannot be changed by the communities themselves. So the pandemic, of course, didn't create these problems. It exposed them. Implication, the province problems are not exceptional, right? It mirrors the challenges across much of sub-Saharan Africa. And I mean, we have cases in Zimbabwe, Botswana, colonial legacies, institutional fragmentation, and climate impact, and competing uses for scarce water resources. And I dare say communities should not and cannot wait for systemic reform. And And also, just two things, Wilfred, I see you stood up. Water insecurity is not primarily a scarcity problem, but it is reproduced by the factors that I discussed just now. And I think, yeah. Next, if you could. Conclusions and some recommendation. We recommend shift from infrastructure-centric to governance-centric intervention, reframe water from a commodity to a right, and reverse neoliberal cost recovery model that price the poorest out of basics access. Next, please. Okay. In line with the theme of the conference, I would like to keep this quote: Africa's water future is not predetermined. It depends on the choices we make today about governance, allocation, justice. The alternative futures are stuck. A future where adaptation strengthens resilience and inclusion, or two, a future where climate stress deepens inequality and dependence. This research and this paper argues that for urgent systematic reform to realize the first future, which is future one, where adaptation strengthens our resilience and inclusion of our local communities in the processes. Thank you.
You know, you see things going, you don't mind, you get on, doing whatever, and you are swimming, drinking at the same time. Here we are today. What was happening? I don't know. Any questions, colleagues? I'm just saying this for you to reflect. Questions?
I think you must press something. Yeah, I can come closer anyway.
It was really insightful. I realized during the day, during the different presentations, there's a theme that's coming across about the issue of decentralization and I guess the challenges that it's posed. And you mentioned like the issue of deduplication of functions, lack of local capacity and resources. And I remember someone mentioned the fact that national governments make ambitious policies without considering the local resources and capacity. So I want to know from you, do you think there's a way of centralizing functions while still providing a local and context-specific and timely solutions? So this would be from national government. And if not, what is the solution then to overcoming the decentralization gaps in governance that we're seeing today?
Thanks for that. Okay, I don't think the argument I make specifically is for around decentralization. Of course, where we come from is that water rights were vested in the chief, where it was vested in, there was, controlled by the Induna within those communities, I have a funny story that I will tell you offline about access to water in one of the study area, in one of the villages in the study area. But here the issue is that the model in itself, it's intended to be helpful to communities, but there's issues around lack of capacity to deliver these services, right? How do we capacitate through those ambitious policies and plans? How do we not water them down, but how do we take them down to municipal level and enable those municipalities to be able to deliver the services to the municipality? So you have issues of technical skills. Not many engineers are found in the rural municipalities that are required, the skill sets that are required. And of course, and I know we are in Namibia, maybe I will whisper and say we have issues of corruption that we have to consider. So we have many issues that we have to fix, but it's not only DAG. I think we have certain cities that we think they are applying the models very well. But for me, the issue is centering rural communities at the center of the decision making around those policies. I think municipalities find themselves unable to integrate communities in their decision making. Of course, you have processes like IDPs, but really, how effective are they? But thanks.